So, having mastered the cheesy swallow and the Mona Lisa swallow, we need to move on to put everything together so that we can have a postural position rather than a functional position. The swallowing and function is important, but what really dictates the structure is posture. And function and posture work hand in hand, but posture is the most important. And we must also bring in the head position. Some time ago, there was a charismatic and influential physiotherapist in New Zealand called Mackenzie. He developed the Mackenzie roll. It probably all really was remembered by many people. But he also worked on getting people's chins tucked back up so their head was on the roof of their mouth. Their head was on the roof of their shoulders, on the top of their shoulders. Now, he had noticed that people with lower back pain and neck problems had this forward head position. And he worked on getting the chin tucked and the head and neck posture correct. I feel that one of the things he was missing was getting the posterior third, the back section of the tongue, fully up onto the back of the hard palate and the soft palate, which is one of the supports of the head, but missing because of infants needing to breathe through their mouth due to nasal blockages. And this natural position of the tongue is lost at a young age and never regained because people have their tongue too low, taking away the head support, allowing the tongue to drop down. You understand the other parts of craniofacial dystrophy. This fits together very well, and it's important to have that posterior third up, but also the posterior third of the tongue has subconscious innervation, so will continue to work when you're not thinking about it. Also, the posterior third of the tongue has been closely related in its innervation and control with the deep cervical muscles of the neck that are thought responsible for maintaining head posture. So it's highly likely that the posterior third of the tongue is part of the postural support for the head and neck that's been lost. And we now need to retrain that muscle not only to hold the head and neck upwards, but to help hold the maxilla upwards and create a better facial form as we try and achieve an orthotropic treatment. Now, understanding the Mona Lisa swallow gets the tongue into the correct position. But that's mainly the anterior two-thirds of the tongue, which is this highly innervated section. As I'm talking to you now, I'm really working with the anterior two-thirds of my tongue. I'm really not working with the posterior third of my tongue, which is a bit I need to work on next. Now, so Daniel, when we were doing the cheesy swallow, we were working with your lips apart, working on you getting to work without using the anterior muscles of the face, or without using any of the facial musculature. Now, the next thing we need to do is work out how to use the posterior third of the tongue. And the posterior third of the tongue, for some reason, becomes activated when you do a very, very cheesy smile, so cheesy that you raise your eyebrows up. For example, if we use the principles from the cheesy swallow, but then we also raise our eyebrows and our smile into a very, very cheesy position, you will notice something strange happening in the back of your throat and your airway. You notice the posterior third of the tongue raising up at the back. So if you try to do that and see if you can discern the posterior third of the tongue. Did you notice something strange coming up? Try again. Practice makes perfect. Really easy smile. Really high. Something coming up the back. So what you're identifying there is the posterior third of your tongue is now raising up. Now because you, like most of the population, me and everyone else we see in normal life, have a face that's a little bit back and down. You lack slightly the area on the roof of your mouth for your tongue to function correctly. Subsequently, when your posterior third of the tongue is right up there, it'll slightly restrict your airway. So, now having identified it, try a couple of times more to really get the feel of the posterior third. And then you can even swallow again using the Mona Lisa swallow pattern. But now having identified the posterior third of the tongue, you can swallow with the Mona Lisa swallow as well as the posterior third, because you now understand and recognize. So now I can feel the posterior third of my tongue pushing up onto the trampoline-like structure of my soft palate, helping to raise my whole maxilla and support my head. And the trick then, from that point, is to do the Mona Lisa swallow with the posterior third of the tongue engaged in the soft palate at the same time as we do the Mackenzie chin tuck. And with that posterior third fully engaged on the soft palate, and every 10 seconds or so, making a sweep to collect the saliva as it appears, we can reinforce the position of the whole tongue on the roof of the mouth, holding the head up into the correct position. By using the sweep and the vacuum of the swallow, we vacuum our lips back against the teeth, holding the tongue in the roof of the mouth. Every 10 seconds, doing another sweep, pushing hard with the tongue on the roof of the mouth, so that the muscles, the jaw closing muscles, are activated, but the teeth are fractionally away from biting. And maintaining some suction in your mouth. And this position can be maintained for long periods. A tip I often tell people is when they're in a car, push their head back onto the headrest. But not by tipping backwards, by translating backwards. You can do the same when you're on a train or an aeroplane. But you push the head back so it's fully engaged on the headrest. Doing the correct swallow with the posterior third of your tongue fully engaged, holding your head upwards, swallowing every 10 seconds with a reasonable amount of muscle activity that you gently calm down. And a fantastic way to remind yourself to do this is if you have some form of necklace or pendant, and you place the pendant between your lips passively, not so you're holding it with your lips, but so that it's passively between the lips in their normal position. If you let your lips separate, the pendant will fall out, reminding you to maintain this position. And better still, you can get a pendant that on a chain or a leather strap that can be shortened so that you help pull yourself back in to the correct neck and head position. And this helps you maintain this. And also, with a final detail, your lips should pout very fractionally to give you that good lip form. Because the lips are made purely of muscle. And if you function correctly with your lips and posture correctly, they will improve their shape and form. Because people with good lips have good function and posture.